Which of the following adverse effect? You see, there's a reason why I put adverse. You should just not skip it and let that go. The nurse should assess due to the long-term use of steroids. So there's a steroid here. Without reading the stem of the question, I already know what the examiner is asking me. Adverse effect when I assess a patient on long-term use of steroid. But just read the stem and figure out. Patient is an asthma patient. That's why he's on steroid, right? And he presents to the pulmonary clinic for follow-up. Is irrelevant. It's just a follow-up. But when what do you see when you assess this patient? The keyword is steroid and assessment. And then you bring your content. You know what steroid does. Steroid does. But if you know what steroid does, it should not be so confusing. I try to make things easy. Sometimes no direction, use words to remind you about content. Whenever I see steroid, I said, things has to go up. Steroid is never good. Except probably because it's osteoporosis, so it makes things go down. But most of the signs and symptoms you see with steroid, things are bigger, your heart rate go up, your blood pressure go up, you gain weight. Like you said, osteoporosis is the other thing. It make you bleed because what? You have ulceration. You know that it make things up. There's no way you're going to choose weight loss. If you know your endocrine, you know Christian is the same thing. When you see everything you know about Christian, you can use it to answer this patient question. When you're a Christian patient, well, you have asceticism, right? Alopecia, that means you don't have it. So asceticism is opposite that. If you don't know number 3, just let it go. But look at the things that you know that you think you can eliminate. Look at the things that you know you can eliminate. You know, I told you, you make things goes up. I don't have to go into detail, but hypoglycemia does not mean things are going up. Using that strategy, 1, 2, and 4 is gone. I have no clue what is number 3. But you have to pick it. Don't be nice. You know your content. You know it's not going to cause weight loss. You know it's not going to cause alopecia. You're going to have a lot of hair on your skin. You know it's going to increase your glucose. So why do you want to choose number or 1 or 2? You definitely know they are wrong. This and this are wrong. Therefore, you got to pick number 3. Steroid causes weight gain. Steroid causes asceticism. And this is not what I see there. I see weight loss. The examiner is not confusing you. He's just telling you, hey, it's not weight loss. Whatever you know is enough. Don't overguess yourself. You know, I know you guys have been studying, so you know stuff. So when you said questions, when you see it, just answer it. So the right answer is number 3. You don't need explanation why it does that. It's one of the common side effects of steroid. But I give you enough information to say, oh, 1 is wrong, 2 is wrong, 4 is wrong. Most of these questions I'm doing, I'm not just teaching you content. I just want you to know how to answer questions. There's no magic to it. You look at what they're giving you and your understanding, and then knock out the answers. If you knock out the answers, your chance of answering the question improve. If I knock number 1, now I have 3. I have over 25% getting the answer, 33%. If I knock this out, I have 50% chance of getting it right. So try to do that. Same thing. Which of the following is indicated due to the IV infusion of erythromycin? Erythromycin. Do you see the buzzwords there? Do you see, this is the axe of the case. Okay, the question is asking you, which of the following is indicated when you're getting infusion of what? Erythromycin. Then you ask yourself, why is he asking me this? There's a reason why. So you look at the term, you said, a nurse is caring for a client on what? Erythromycin IV for cellulitis. Which of this is indicated? Before you look at the answer choice, you say, what is erythromycin? That's why. Go for the jugular, go for the keywords, and when you use it, it's easy. The jugular for this is what? Erythromycin. What do you know about erythromycin? Spend 2-3 seconds. I know it's an antibiotic. If it's an antibiotic, what kind of antibiotic is? You know, it's a macrolide. Macrolide. And he has the mycin. These are the true macrolide. What is the one of the biggest thing of macrolide you should know for your boards? Never forget it. Never forget the macrolide. They don't like calcium. And then what? They affect your cardiac function. Okay? They bind to calcium and they affect your cardiac function. And therefore, what did they do? QT prolongation. That's all. If you spend time and you do that, you should be able to answer the question. If you don't know, look at what I'm going to do to find the answer. I don't know that erythromycin is a macrolide. I don't know that they have high affinity for calcium, so they bind calcium, and it causes QT prolongation. Okay? And it causes arrhythmia, right? I don't know that. Look at the answers. 3 of them, you have to go to radiology. 1 of them, you don't have to go to radiology. If I have to go to radiology and go get a CT scan, MRI is also a scan, PET scan, we're all going to radiology and go get something from there. And they're all doing what? Looking at the body image. You see test-taking strategy. This is what I want to see. They're all taking picture of your whole body, the whole body. CT scan, the whole body. MRI, your whole body. PET scan, your whole body. The only thing that does not take picture of your whole body is this. And it doesn't take picture. It takes function of your heart. You see how you can answer a question without not knowing. It's just text-taking strategy. Don't run away from it. Don't read it, the question and say, oh, I don't know what erythromycin is. I'm confused. Just if you can know that, you don't know that it's a macrolide, it causes QT prolongation. Look at the answer choice. I told you, 3 things are taking picture of the whole body. And only one guy is not doing that. Therefore, number 4 is your right answer. Try doing that. Critical analysis of the question and then breaking down, and you see that the answer will pop like a candy. Like I always say, first you got to master your content. Then second, you got to figure out how to navigate through the case and be able to answer it. Okay? You guys will be fine. This is another one. There is no big content. You don't have to read a whole, 500 video. There's only one. That's all. If you know what methotrexate is, you answer the question. Which of the following is very concerning? I just try to make the question short and sweet as much as possible. Which of this is very concerning? A nurse is caring for a client on what? Methotrexate for ulcerative colitis. Ulcerative colitis is irrelevant. The question is asking you methotrexate. But the ulcerative colitis give you an idea, telling you that this is used for immunosuppression. One is an immunosuppressant. Whenever they give you a medication and they ask you concerning, pay attention, keywords. Look for the side effect and one side effect will become an adverse effect. Go for the adverse effect. That's the most serious one. If you don't want to use that, say, which of all these side effects I have to worry about? Every medication has a bunch of them. But there's one effect when we see, we know the medication is doing you harm than good, right? Then you have to figure out which signs are usually normal. So this is what I call be sharp and not expected. Not expected finding. This is my prioritization. This is where I get it from. You have to be sharp, but not unexpected finding. When you take methotrexate, look at it. I put dizziness and drowsiness. Why would you have to pick one against the other? Dizziness and drowsiness, they're giving you the same effect. Test-taking strategy. This is an expected finding, and this is an expected finding. You see the two, you can't pick dizziness over drowsiness. You know, when you're drowsy, you're going to be dizzy. All of them, you're going to fall. 4 rigs, all of them is interconnected. Headache is related. But I wanted to show you this, that, and that. They are common side effects of the problem of methotrexate. The other way to be able to figure out methotrexate is immunosuppression. Immunosuppression, most medications that are immunosuppression, they affect your bone marrow. So your WBC goes down, your platelets go down, and your RBC go down. It causes aplastic anemia. This is the serious side effect of this medication. Apart from that, the other ones, drowsiness, headache, GI symptoms is most common, and so they are not that bad. Bleeding gum, it means your platelet is low, and this is your right answer. Like I said, most of these questions I try to make it a little bit difficult, but to be able to see, to like go through the weeds and be able to identify relationship between two answers to say, hey, I got to get rid of this. I have a better answer than that. Okay, so this is your answer. This is a therapeutic communication question. The best way to answer therapeutic question is to be nice. Don't ask for why. Let the patient talk. If the patient is talking, it's good. If you talking, is wrong. If you have to talk, ask for more information. This is my 5 tips for therapeutic communication. You can rewind this information again. But when you're talking, ask for more information. You shouldn't be talking. Patients should be talking. And don't ask for why. That's all. It's that easy, right? There's no long lecture on that. Straightforward, right? A nurse is caring for a client prescribed adalimumab. I put the big word for you to confuse you for ulcerative colitis. The client refused the medication and said, I don't like the way the medication makes me feel. What is the next best action? I said, don't talk. Let the patient talk. If you're talking, ask for more and don't ask for why. I will call the doctor to change the medication. That's not what the patient said, right? You have the right to refuse the medication. That's not therapeutic. I know you have the right, but you got to be a nurse. Tell me how you feel when you take the medication. You want more information? Excellent. Non-compliance will lead to recurrence flare-up of your condition. You're stating a fact. It's not therapeutic. It's not among the 5 things I told you. Don't talk. Let the patient talk. If you're talking, ask for more and don't ask for why. You see? Straightforward. Your key for therapeutic communication is what I've given you. You don't have to struggle when you see therapeutic communication. It's the same thing they will ask you. So the right answer is number 3. Following the nurse you expected finding, test taking strategy. And next, evaluate a client with Addison disease. What should you expect? Well, you got to bring your content. In endocrine, I call it bidirectional. If you don't know Addison, whenever I see endocrine question, I just write bidirectional. If you don't know Addison, just go the opposite way. Go to Cushing and write the Cushing symptoms. And if there's Cushing symptoms here, you cancel it. Or you just go to what you know about Addison. The opposite is Cushing. So if you know Cushing, you can answer it. Let me do it for you and you see. If I have Cushing, I have hypertension, right? Do I see hypertension here? Yeah. I have what? Weight gain. I don't have weight gain here. This is weight loss. Therefore, this is already wrong. That is the way you can attack it, right? Hypertension, weight gain, right? I have asceticism, that's Cushing, right? And I have what? Those three things is enough. I have central obesity. This is all Cushing. And I take this answer choice and then use it to answer mine. You can do opposite way. Addison, oh, I don't know Addison too much, but I know Cushing. So if I see Cushing answer there, it's wrong, right? So I know Cushing is hypertension, weight gain, asceticism, central obesity. They asking me for Addison. I see weight loss. Okay, it's not weight gain, so that may be Addison. Bronze pigmentation, I don't know, but I see hypertension here. I know hypertension is Cushing, therefore this answer choice is wrong. Number two, I see central obesity. I know this is wrong. Maybe hypotension is opposite. That's good. I see asceticism. I know this is wrong. Number three, hypotension is not hypertension. Okay, good. Weakness, I don't see either. Weight loss, I see weight gain. Oh, I say number three is good. Bronze pigmentation, I don't know. Weight gain, yeah, it's wrong answer because it's Cushing. Hypertension is Cushing. Therefore, the answer choice has to be number three. That's how you can answer endocrine question. If you have no idea, take the one you know. If you know Addison, well, when they give you Cushing question, use the Addison to try to change it to that. And then, but make sure you're answering the Addison Cushing way. They give me Addison, I say, I don't know it well. I write what the things I will see in Cushing. And I see, if I see any Cushing answer there, I know the answer choice is wrong. Therefore, hypertension is wrong. Central obesity is wrong. Weight gain is wrong. Hypertension, this is good. In Addison, you see bronze pigmentation. You see hypotension. You see weight loss. You see fatigue and weakness. That's what you see. So number three is your right answer. See, that's the way to do this. Like I said, test taking strategy. How to answer the question. You have no content or a little bit of it enough to be able to answer the question. Which of the following should be concerning to the nurse? A nurse assessing client with SIADH. I just write a question straight and easy as much as possible so that you can just focus on it. Right? So, SIADH, which should be concerning to the nurse. You say what? SIADH. Well, you have too much ADH. It's going to hold on to water. And when you hold on to water, your urine output is going to be what? Low. Your specific gravity of your urine is going to go up. Your blood pressure will go up. Right? You retain water. With this is hyponatremia. And hyponatremia lead to what? Seizure and confusion. This is number one. Your blood pressure is going to go up. Fine. Your urine output is going to go up. Fine. You're going to have decreased response to stimuli. Fine. You're going to be confused. Which of this is concerning? Severe hyponatremia is present as confusion in seizures. Even though you're going to have decreased verbal response, it's fine, but the time verbal response is an indication of hyponatremia. But when you're manifesting confusion, you have very severe form of hyponatremia. So if you pick 3, it's okay, but this is the worst one. Confusion means your hyponatremia is worse than you have a decreased response to that. Your urine output is going to go low. Your blood pressure is going to go up. But this should be what is concerning to you. This is how you take exams, okay? The NCLEX cannot fool you because you know what you're looking for. This is classic adapt NCLEX way of setting questions to make you think. Classic. 2 lines, but it's loaded and it's test-taking strategy. Which of the following the next you expect, right? Right-sided heart failure. You draw your heart and you say your lung is here. This is your right side. This is your left side. If you have left-sided heart failure, most of your symptoms is your lung or output problem. If you have right-sided, it's systemic. You see what I did? Right is systemic, left is lung problem and output problem. Lung and output problem. Then I look at the answer choice. Pink fluid sputum, this is worrisome. It's pulmonary edema, but it has nothing to do with the right-sided heart failure. New S3 is the right side of your heart. Low urine output is a output problem. Try to make the questions easy. Therefore, all this is something to do with your left because it's affecting your lung or it's an output problem. The only thing that does not affect your lung and output is inflow. So neck vein distension is the same as jugular vein distension. It's the same as central venous pressure. Okay. Test-taking strategy. And the last one, the last question. You can see, you got to be sharp. That's what I said. All of these people, they are confused. Which confusion is more dangerous? That's what I leave with you. Think about it. Think about it. I'm not going to give you the answer. But which confusion do you think is the most dangerous of all confusion? Diabetes, sugar is low, and is confused. Somebody with sepsis, has sepsis, cellulitis, and is also confused. Somebody who has hyponatremia, and is also confused. Somebody who has left femur fracture, and is also confused. If you want to know how to do this, check Adapt NCLEX. Right. Put your answer down in the comment. This is the way you do prioritization. All of them are confused. All of them are sick. But who do you think is the most prioritized patient? If you have 1 second, if you have 1 second, who would you give it to? You be the answer. I know you've learned something, how to answer questions from Adapt NCLEX. But you got to master this. This last one, I want you to ace it. But if you can't, you send me an email. I will explain it to you. But put it in the comments. I will see what people answer, and I'll answer it later. You have a good day. Enjoy yourself. Be good.